I'm Stan Fahn from New York, and I'm going to be interviewing Mark Hallett for the Movement Disorder Society archives. Today's date is Sunday, June 16, 2003. And Mark is being honored with this interview, and we want to learn more about him. So, Mark, let's just start out with your early years before you became involved with movement disorders. Tell us where you came from and what your schooling was and something about your background.
Sure, but before we start, I'd like to just say I'm honored to be interviewed by you. You're one of the founders of our society and also one of my good friends, and so it's a real honor and pleasure to be interviewed by you. So in relation to how I got interested in the whole business, I suppose it began in high school. I had a high school psychology course, and it was probably one of the best teachers that I had in high school, and I got interested in the brain at that time. I did my term paper on Freud, interestingly enough, which will become relevant later in the story. But I read a number of Freud's books at that time and got particularly interested in the brain. And that was always in the back of my mind as being something of particular interest to go forward with. However, when I went to college, I was also interested in more basic sciences, and I started out majoring in astronomy, of all things. But I got sort of disillusioned by that. That seemed to be too complicated, and they didn't quite understand what was happening, and I thought that going back to biology and my interest in the brain would be something better to do. My father was a physician, an ophthalmologist, and the combination of studying the brain and going into medicine seemed to be a reasonable thing to do, and I got more and more interested in that direction. One of the things that finally settled me on it was a talk at the Harvard Psychology Department by Norman Geschwind. Geschwind at that time was at Boston University, and he was very interested in a number of different behavioral syndromes. And he gave this talk on alexia without agraphia, which is a talk that I must have heard him give 10 times in the end. But it was a very exciting talk about how the brain worked. And this was an evening talk in the Department of Psychology. And I remember leaving that talk saying, I've settled what I'm going to be doing, going into something having to do with the brain and medicine.
What year in college was that?
So graduated Harvard College in 1965, and that probably was in 1964 that lecture happened, and so it convinced me that that was the right thing to be doing.
Had you already applied to medical school?
Yes, well, I guess that's right. Yes, I must have applied to medical school already, but it sort of sealed the whole thing. I mean, that made me, it was the sort of direction that I was going, but I was really completely settled at that point that that was the thing that I should be doing. Now, I didn't know whether it was going to be neurology, psychiatry, or neurosurgery, because they were all involved with the brain, and I knew that that was going to be interesting. My father was still trying to convince me to go into ophthalmology, but I knew that the brain was the thing that I wanted to do.
So college was Harvard, is that correct?
Right, Harvard College.
And I understand you grew up in Philadelphia, so you went to high school in Philadelphia?
Right. I went to high school in the Philadelphia area. The suburb of Marion is where I grew up. I went to Hallett High School there, which was the second high school in Lower Marion Township. And our class was the first class to go all the way through Hallett High School. And to say how long ago it was, the high school has just been torn down and replaced. So that was quite a while ago.
Okay, and then I understand you went to Harvard Medical School.
Right. So I went to Harvard College, and then I went to Harvard Medical School. When I started medical school, I guess I was most interested in neurosurgery, particularly because of pediatric neurosurgeon by the name of Donald Mattson. He was a very impressive person, and I think most of the people in the class felt that he was the most impressive person that we had seen. He used to give us some talks, and everyone thought that he was extremely knowledgeable. He was kind to the patients, and he seemed to just be a perfect physician. And if he had lived, and I'll finish the story in just a moment, I might very well have wound up in neurosurgery. But when I was in my third year, when I was sort of beginning to make a final decision, he came down with a very curious illness that no one figured out. And in fact, when I had my neurosurgery rotation, we were actually rounding on him every morning. He just got worse and worse neurologically and finally died. The postmortem was unclear, and at that time, the only way to make the diagnosis of Creutzfeldt-Jakob disease was to pass it into monkeys. So part of his brain was sent to Carleton-Gajdusek, and it did, in fact, transmit, and so he had a form of Creutzfeldt. And so I lost a little bit of interest in neurosurgery, and at that time, I didn't think psychiatry had much to offer, so I wound up in neurology, even though my father continued to push for ophthalmology.
Okay, and I did hear the story about Mattson getting Creutzfeldt-Jakob, and they thought maybe he did a biopsy or some operation on a person who had Creutzfeldt-Jakob and maybe got contaminated during the procedure.
Yes, no one really knew the final story of that in the end. There was also a story that he had done a pneumoencephalogram on somebody else that had Creutzfeldt, so it wasn't exactly clear where he got it. And his case was not classic in any way. He also had some skin lesions. I've forgotten what they were, and so it was a combination of some skin lesions and the neurological syndrome. And of course, at that time, there wasn't any other way of making the diagnosis.
So getting back to you, you're here in Harvard Medical School now. You decided to go into neurology. You applied to several programs. You stayed in the Harvard program system.
Right. Stayed in the Harvard program system. So at that time, I really knew that I wanted to go into neurology. And there was you had to have 1 year medical internship. And actually 2 years was recommended at that time, but I wanted to go right on to neurology. I knew that I wanted to do that. And it was a little bit tricky. At that time, you had to sort of fool the internal medicine programs that you were not interested in internal medicine. But I got my internship at what was then the Peter Bent Brigham Hospital. And I had signed up for the neurology program at the Massachusetts General Hospital, so I had signed up both of them actually at that point. Now, that was during the Vietnam War, and we had to make a deal with the military at that time, and one of the best deals was actually not with the military, but with NIH. That was an alternative to going to Vietnam, and I had also applied to NIH, hoping that I could finish my neurology and then go to NIH as a neurologist. But in the spring of my internship at the Brigham, I got a telegram from the NIH saying that I needed to come to Bethesda July 1st of that time was 1970, and show up and spend my 2 years at that point. So I had already signed up for the neurology program, and they were sort of expecting me to come, but I had to call Ray Adams and say, sorry, I can't make it. I'm basically drafted at that point. They, of course, understood because that was happening all the time in those days. So I went off to the NIH. At that point, I had clearly gotten interested in central nervous system physiology. I was sort of interested in how the brain was working, and I guess that really was my interest all along from the high school psychology course even that I mentioned. But what I got in terms of jobs at the NIH was to work with Ichiji Tasaki. Tasaki was a Japanese gentleman who'd been at NIH for a long time, and his interest was in membrane biophysics. Now, I had taken a course in biophysics when I was in college, and I actually wrote my term paper on Tasaki's work. So I knew every paper that Tasaki had written up to perhaps a couple years lapse beyond I'd gone to medical school. So it was so I was a pretty good candidate for his job, and so he selected me for this.
So you
position.
applied to go into his program and for training.
I had actually applied to several programs. His was certainly one that I did apply for. He had an opening. The job that I really wanted was a job with Ed Everts. Everts also had where he at that time was also taking people. However, that particular year, when I went to talk with him, he said he had no openings. In his laboratory at that time was Malin DeLong, and I think Tom Thatch was just leaving the lab at that point. So they were a lot of the leaders in motor control, and so that was the lab I wanted to go to, but he had no openings, so I couldn't even apply really to that lab. So in any event, I went off to work with Tasaki. It turned out to be an excellent 2 years. I did some very interesting work on membrane biophysics, and but I got a lot of interaction with the Everts group and with a lot of other people in NIH who were interested in neuroscience. Now, neuroscience at that time was just a developing field. When I was at NIH, at that time was the first meeting of the Society for Neuroscience. It was in Washington. And that sort of gives a sense about how everything was just sort of starting out in neuroscience. We had a general journal club that consisted of all the people at NIH that were interested in neuroscience, which was probably about 10 of us. And we would meet weekly, read a paper, something in neuroscience. At that point, everybody was expected to know the full range of topics. Malin DeLong was in the journal club also at that time, and I got a little bit interested in motor control, particularly from some of the papers that he had selected. But there was another seminar that also went on that got me interested. I had mentioned that I was particularly interested in Everts' work, because they were doing some very nice work recording from monkeys during different types of behaviors. Everts was a pioneer in that regard. And in my, I guess it was in the second year that I was there, that Ragnar Granit, who was a Nobel Prize winner, came to NIH as a Fogarty Scholar to spend some time with Everts. And they had a weekly seminar on motor control that was extra to this regular neuroscience journal club that a number of us had. And that went on also for that year, culminating in an international meeting on motor control, of which people like Denny Brown and Sid Gilman and I think David Marsden might have been there also at that point. But in any event, it was a very interesting meeting and a very interesting series of things. And by the end of those 2 years, even though I was doing membrane biophysics as my major activity, I got more and more interested in motor control through Everts and DeLong and all these seminars that were happening. I had to reapply for neurology residencies. Ray Adams didn't just say, well, you could come now. He actually made me reapply, but then he re-accepted me, which is where I wanted to go. So then I went back to the MGH, back to Boston, for my 3 years of neurology training.
Somehow or other, I mean, although you were interested in motor control and physiology, you decided to pursue into movement disorders. And that was in your residency, and you wanted to work with David Marsden, I understand.
Right. Well, actually, at that time, movement disorders wasn't really much of a field. It was just sort of developing. I mean, it's the field that you and David developed, and it still was pretty primitive at that time. I was interested in motor control and motor physiology, and when I was in the second year of residency, we were expected to do some sort of research project. And since I got interested in motor control, I wound up spending that time in the lab of Robert Young and Bhagwan Shahani. And I had a motor control project that I had in mind that came from some of the reading that I had done actually while I was at NIH, looking at the patterns of EMG activity underlying fast movements, or so-called ballistic movements. And I wanted to look at that, and I wanted to look at the influence of lesions in different parts of the nervous system. So I looked at Parkinson's disease, cerebellar ataxia, and so on. But I was really interested more almost on the motor control side than the movement disorder side. And how I got hooked up with David Marsden is sort of an interesting story as well. When I was finishing residency, my wife and I, we wanted to do a year abroad. And for some reason, I'm not sure exactly why, we wanted to go to London. Now, I had met Tom Sears when I was working with Tasaki. Tom Sears was the head of physiology at Queen Square at that time. He was a membrane biophysicist. He had actually come to Tasaki's lab to learn saltatory conduction. Tasaki's most famous medical discovery was saltatory conduction. And Sears came to the lab to see how Tasaki measured saltatory conduction so that he could do that at Queen Square. So I had met him, and my original plan was to work with Sears. Even though I'd gotten interested in motor control, I really was an expert in membrane biophysics from all the stuff that we'd done. So I was thinking that I would work with Tom Sears, and that was sort of the plan. Now, in order to fund it, I actually got a fellowship from Harvard Medical School. There's a program called the Moseley Traveling Fellowship, which Harvard Medical School gives, and I made application for that. So I got my own funding, and I could go anywhere I wanted. And as I say, the original plan was to work with Sears. But then I had seen some of the papers that Marsden, Merton, and Morton had written on the long latency stretch reflex. And I thought that they were particularly interesting papers. And the year before I was to go to London, where I was planning to work with Sears, I went to London. I met with Tom Sears, and I said, well, why don't I go meet with David Marsden as well, because he's doing some good stuff, and I can go anywhere I want, and maybe he would be interesting. So I went to visit him, and he said, sure, come. It was easy for me to come because I had the money. He didn't have to pay me anyway. So then I went back home, and I debated for a couple months, actually. Should I go work with Sears as planned, or should I go work with Marsden? And everybody I asked said Sears. Nobody knew David Marsden at that time. He was just a new professor.
And what year was that?
So that was, I was probably making this decision in 1974. I guess he was probably appointed something like 1971 as the professor at the Institute of Psychiatry, probably just for a couple of years that he was there. And everyone I talked to, no one had the slightest idea of who he was. He said, oh, work with Sears. He's at Queen Square. He's the head of physiology, and he's well known. At that time, he was on the editorial board of Brain. Everybody knew him. Nobody knew who Marsden was. But I said, this is interesting stuff on the long latency reflex, and I was working on these rapid movements, and I thought it would be interesting to interact the long latency reflex with the ballistic movements. And so that was the project that I had in mind. And I finally said, I'm going to go work with Marsden. So that's what I did. But it was entirely a motor control plan. It had nothing, again, still had nothing to do with movement disorders. Well, I mean, there's obvious interaction between motor control and movement disorders, but I was really interested in the motor control side. of things. And when I arrived there, it was shortly after the observation that Lermite had made that 5-HTP helped post-hypoxic myoclonus. David had gotten very interested in that, and he co-opted David Chadwick, who was Ted Reynolds' registrar, and got Chadwick to bring in patients with myoclonus from all over England. David would work them up clinically, and then he brought them to the laboratory, and then I did physiological studies on them. It wasn't part of my original plan, but they needed the physiology to be done, and I turned out to be the physiologist in the laboratory since I was there. It was an extremely productive set of experiments that we did at that time, and worked out the sort of basics of a number of different types of myoclonus in the patients that were sent in to us. Produced a series of probably about 10 papers that came out looking at the physiology, the pharmacology. David Chadwick took the lead on the pharmacology. I took the lead on the physiology of those patients. And so that was sort of my introduction to, I guess, the basic motor control of movement disorders. I also and I did the main project that I had intended as well. That paper was eventually published in the Journal of Physiology, so it was a reasonably good paper. I got to meet Merton and Morton as well as Marsden at that time. Marsden, Merton, and Morton had their own laboratory at Queen Square, where they used to work on the weekends. David had his clinical work during the week, but they had, and Pat Merton had his physiology classes to teach in Cambridge during the week, but on the weekends they would get together at this Queen Square lab, and I was invited there twice to work with them, which was a very interesting experience. And Pat Merton got interested in my experiments, and he came even as a subject one day to the Denmark Hill Laboratory to be one of my subjects for my rapid thumb movement experiments. In the beginning he thought, well, what's a silly thing to be doing, but then he got interested in it himself at the end. So it was, so I got to know all those guys. Peter Jenner at that time was running a pharmacology lab on the second floor of the research building, and I was on the first floor of the research building. And a woman by the name of Jane Adam was a PhD student. Pat Merton had sent her down from Cambridge to be the PhD student, so she and I shared the laboratory. And so I was there from July of '75 to June of '76, and then '76 I went back to Boston, which I can speak of in a moment. And then Jane Adam got her PhD at that point, and then John Rothwell came into the lab as the next PhD student. So when Jane and I left, John Rothwell came into the physiology lab, so he inherited the lab that we had been working in.
Okay, so when you went to London, and it was going to be a year, did you know what you were going to do after that year? And by the way, once you worked there with Marsden, Merton, and Morton, all three M's, the three M's. You got hooked into this field, even more hooked than you were, clearly, and also you got into a myoclonus field, which is, of course, one of the movement disorders. Anyway, what did you have in mind to do after that year, though?
Yeah, no, that's a very interesting question. So when I finished my neurology training, I started looking for jobs, and Ray Adams said, well, of course you can stay at the Mass General. And I said, well, what are you going to pay me? And he said, pay? Apparently the deal that he made with the people who graduated there, you could stay if you want, but you have to earn your own salary somehow, which didn't immediately strike me as something that I knew how to do it. So I also wrote letters to a variety of other people hoping to find a job. But actually, when I left for the fellowship, I didn't have a job. to go back to. So I didn't exactly know what I was going to do when I came back from the fellowship. But what happened is that after being there just a month, I got a letter from Rick Tyler at the Brigham. A guy by the name of Ken Nakano had been running the physiology lab at the Brigham, and he decided to return to his hometown of Honolulu. And Tyler was without a physiologist.
When you say physiology, you mean like EMG lab?
The clinical neurophysiology lab, EEG, EMG lab. And so I had applied to the Brigham, and Tyler wrote me and said, well, how would you like to take over the clinical neurophysiology lab? Wrote back right away, I'll take it. Now, I didn't know how to do clinical neurophysiology, particularly. I had done some, of course, as a resident, but I hadn't done that much. So another thing that I did during my fellowship is to spend time learning EEG and EMG. So not only was I doing the research, but then I also got the clinical training in clinical neurophysiology. I did my EMG training with Peter Payan and my EEG training with Maurice Driver. I spent a half day a week with each of them learning the clinical neurophysiology trade. And Payan said that one of the things that I should do as part of my training is to spend a week with Erik Stahlberg in Uppsala, Sweden, and a week with Fritz Buchdahl in Copenhagen. So in the spring of that year, I spent a week with each of them studying EMG. At the time that I went to Uppsala, Carl Erik Hagbarth was the chairman of that department, and he was an extremely good motor control physiologist, and I got to see some of the microneurography that he was doing. David Burke was a fellow with Hagbarth at that time, learning how to do microneurography, so I met David Burke also during that week that I went up there to learn single fiber EMG.
So that year in London was well spent.
That was an incredibly that was probably the most productive year I have ever had. Yeah. In terms of research, in terms of training, it was an absolutely critical year in terms of going forward. Yeah.
And so you went back to Boston and Peter Bent Brigham.
I went back to the Peter Bent Brigham. So I went back in July of 1976 and wound up there for 8 years. And during that time was roughly the same time that Norman Geschwin was professor at the Beth Israel Hospital. And the Beth Israel Hospital, the Brigham, and the Children's at that time sort of joined together loosely as the Longwood Area Neurology Program. And we would all work together at that time. Neurology was not actually a department at the Brigham. Tyler was the head of the section of neurology in the Department of Medicine. So Gene Brownwald was my chief at the hospital, and Charlie Barlow, who was the chief at Children's, was my Harvard chief. And then Geschwind, who I really knew well, I forgot to tell you how I got to know him, but I'll go back and tell you that story in just a second. He was at the Beth Israel, and during that time, it was really one of the heydays, actually, of that program, particularly because of Geschwind coming and the sort of increase in size of the Brigham program. After I came, a number of other people were added to the program, Michael Moskowitz and Howard Weiner, so on. It was just augmenting the research in that area as well. But I forgot to say that during my medical school, one summer I spent with Hubel and Wiesel, which got me interested in single neuron recordings in live animals. And then one summer I spent with Norm Geschwin. He at that time was at Boston University, where he was the chair of the department, but I was very interested in studying with him, and so I went to work with him. We did a lot of rounds. He had a number of students that he would take on for the summer, and so I got to know him at that point. He also assigned each of the students to a research project, and I got assigned to a man by the name of Deepak Pandya, who was a neuroanatomist, and so we did some neuroanatomical research. We were looking at the cortical connections in the monkey auditory system. That paper that we wrote turned out to be my first paper. Deepak Pandya is still working in neuroanatomy these days. He's the grand old man of neuroanatomical studies, and I haven't seen him in a long time, but he was a fine teacher as well. But in any event, I did get to know Geschwin very well that summer, and then I got to know him again when we were on basically the same neurology staff from 75 to 84. In 84, I moved to NIH, and just a couple months after I left, Geschwin suddenly died. So it was approximately the same time period that Geschwin and I were in that program.
Do you have any recall about how we first met?
How we first met?
Yes, the two of us.
Gosh, no, I don't remember.
Well,
you tell me.
I'll tell you.
Remind me.
We shared a car service or a taxi or a ride. Somebody drove us back to Boston from some meeting in New England, and I can't remember what it was. I think you had come back from David already, and you were at the Brigham doing EMG, and you went to the same meeting, and somehow or other we were sitting in the back seat of this car, and we started chatting, and I got to know you at that time a little bit. I mean, so I sort of still have that remembering of that.
Now, there was also the myoclonus meeting that was in upstate New York. Now, when was that? Because I certainly got to know you well at that time.
Yeah,
also.
well, of course, after that was already in movement disorders. That was, we were in Arden House.
Yes, that was Arden House.
And we had a myoclonus meeting. We've also had dystonia meetings there and a lot of other things. That's part of the Columbia University.
Right.
And I had organized that. I had a patron in myoclonus whose wife had post-hypoxic myoclonus, and he wanted to fund more research and education in the field and bring people together, and that was how we got that first myoclonus. And of course, it came a book out, and I got involved with myoclonus through that, and taking care of that patient and studying it, and then we sort of got together around myoclonus also, because you, David, and I wrote a review article together on myoclonus and classifying the condition.
Yeah, and then subsequently, you and Arnold Gold invited me to join the Myoclonus Research Foundation board, and we served together on that.
That's correct. Yes.
For a number of years.
Again, it was the same patron who supported that foundation and wanted scientific research, and we would review grant applications and fund them, and we worked together on that.
Right.
So anyway, you still continue to do motor control physiology. Clearly that's your field.
Right. So while I was at the Brigham, I had major activities in just routine EEG, EMG. We began to do evoked potentials, and that was occupying much of my time. But in my spare time that I had, I continued to do motor control type research activities. And I began to get more interested in the developing field of movement disorders that was going on. So I was applying the motor control aspects to different types of movement disorders, particularly Parkinson's disease, different types of tremors, and so on. So that was the way things were going, and everything seemed to be going along relatively fine. And then my wife took a job down in Maryland, basically, and I had to go follow her.
That's why you went to NIH, because she was going there.
Right. So she went there, and so I had to find a job down there. And I was fortunate in being offered something at NIH and at Hopkins and the University of Maryland, and it took me a little while to make a decision. But I had such a good time when I was at NIH before. I figured, hey, I'll go back there again. That seemed to be a reasonable thing to do. So it turned out to be a great thing to have happened. I think moving down to NIH was certainly a good move for me, and I was able to then carry on and do my research in a lot more time for it. And So so I've now been there about 30 years.
Yeah, so you're still there. I think we should make it clear for the record, and you'll probably be there for many more years to come. So among other things, you got interested in, besides myoclonus and tremors and Parkinson, you certainly have worked with dystonia. You're a member of the scientific boards of the Dystonia Medical Research Foundation, the Blepharospasm Foundation, and so forth. I mean, many different foundations that you have served as advisor for.
Right. So I think the way that I got interested in dystonia was through musicians' dystonia and focal hand dystonia. Studying the physiology of the hand seemed to be a reasonably good thing to be doing. It's a lot easier than studying the physiology of cranial muscles or of leg muscles. The hand area is much more, much easier to see by EEG. It's right on the surface of the brain. And then when the different types of non-invasive stimulation, such as transcranial magnetic stimulation, came out, the hand area is right there. So I got interested in the hand, and we also got interested in botulinum toxin as a therapy. This focal hand dystonia from a motor control point of view was very interesting. From a therapeutic point of view, botulinum toxin seemed to be a very interesting therapy to use in this particular condition. And that was my entryway into dystonia.
Yeah. It's also like full circle, because you were interested in the rapid movements of the thumb way back when you were going to London, and there you are, back in the hand.
Right. No, the hand has always been my thing. Absolutely. Yeah.
Right.
Yeah.
And so if you had to do things over, I guess you wouldn't change anything.
No, I think it was the right thing. It was the right thing to do all the way along. Everything was fine. I suppose, life has all these decision points, and I think that everything went fine with all the particular different decisions that I'd made. Had I made different decisions, I suspect it probably would have been fine too. If I had wound up as an ophthalmologist, I'm sure I would have been quite happy doing that. It's what my father wanted me to do. And actually, David Cogan was another person that tried to convince me to go into ophthalmology. When I was a senior in medical school, we had some months to do electives. Ray Adams actually was my advisor, and he advised that I spend a month with David Cogan. And it was a terrific month. He, at that time, was seeing a huge number of patients. Shirley Ray was one of his fellows during that month. And they would just see patients that I would go back and forth with him and see all the cases of neuro-ophthalmology. Got to know him very well. We wrote a paper together. And he and my father both tried to get me to go into ophthalmology, Cogan particularly into neuro-ophthalmology, which was a field that he basically was one of the founders of. So if I had done that, it wouldn't have been so bad as well. And interestingly, when Cogan retired from Harvard, he went down to NIH. And so when I went down to NIH, Cogan was already there, and so I made his acquaintance again and became friendly with him, and used to go to some of his rounds, and he used to come to some of my rounds, and we shared some interesting neurological problems together.
And we've been working together on the Aspen course, and initially it was David Marsden, Joe Jankovic, and myself, and when David died, we'd asked you to come in and take his place, and you've been doing a great job, and it's been great working with you all these years. And we have, of course, 2 editions of a book together. Hopefully a 3rd edition will be coming out after we work on it, of course. So it's been fun years working with you.
Yes, well, I've certainly enjoyed it quite a lot, and the other aspect of that, which is worth noting for the record, is that we've been doing it twice a year for about 6 years now, because we've been putting it on in India also, as well as Aspen, and that's been an interesting thing as well. Traveling to different cities in India, sort of experiencing the different types of environments that they have there, as
Talking
well.
about travel, you probably break all the world's records of travel. You travel probably more than anybody I know.
Yes, well, I've gotten involved with a lot of different international societies. And I have also gotten involved with a lot of people all around the world. I think that's one of the nice things about having been at NIH. There's been a large number of fellows that I've had from all over the world. NIH sort of has some sort of attraction for people. I guess it always has. And so there have been a large number of fellows that I've had from many different countries around the world. And so I have and I've probably had now 120, 130 fellows. I don't know. I've lost count of how many there are. But and I'm still working with many of them on different projects of various kinds. So I go off with the international meetings, and I have different activities with these different fellows, and so that's what sort of gets me going to these different places. The other thing which probably makes me more active is that I'm really in two different subspecialty fields. The field of movement disorders clearly is one, but the other is clinical neurophysiology. And they are two subspecialties of neurology. There's this obvious overlap of the two, but there are also clear differences in the two. There are different societies and different types of activities. So while I've been very active in movement disorders, having been, for example, president of the Movement Disorder Society, I've also been very active in the clinical neurophysiology area. I was editor-in-chief of the journal Clinical Neurophysiology for a term, and I'm now president-elect of the International Federation of Clinical Neurophysiology. So there'll be lots of clinical neurophysiology meetings, as there have been in the past. There will continue to be those as well. So it's so I have twice as much chance, in a way, or twice as much opportunity, or twice as much obligation, almost, to be involved with a number of international trips of various kinds.
And speaking of many of the fellows that you had that trained with you, I should mention that our current president of the Movement Disorder Society, Gunter Deutschel, had come to you and spent time with you also. Was that a year, or several months? What was that like?
Right. So I had at that point been getting a lot of people from Germany coming over. It almost has seemed like the different countries have come and gone in different cycles. And for a number of years, I had a very large number of Germans that were coming. And Gunter was probably, I don't know, number 8 or something like that. He was much more senior than most of the fellows that were coming. Many of them had just finished their neurology training. Gunter was sort of taking a sabbatical, and he came for 9 months. He was extremely well motivated. He knew exactly what he wanted to do when he came. He had a particular interest in palatal tremor or palatal myoclonus, depending on what you want to call it. And he wanted to do some physiological studies of those patients. So we got a number of those patients in, and we did a whole battery of different physiological studies that he had already had in mind. And then he got involved with a lot of other projects that we had ongoing at that time. So he was more senior and capable of doing a lot more things than many of the other fellows that have come. Although the German fellows that have come have been absolutely terrific people. So Gunter Deutschel is the chair of neurology in Kiel, but 3 more of the fellows that came in my lab are also department chairs now in Germany. There are only about 40 chairs of neurology in Germany, so 4 of them, 10%, have trained in my lab. So it's so I often wind up in Germany. Not surprisingly, they're often inviting me to be there at their meetings since I know them all so well.
And we were in just Germany together about
Yes.
3 weeks or so ago at a Estonia treatment meeting in Hanover. And
Right, and then 2 weeks after that, I was in Dusseldorf for a deep brain stimulation meeting, and so I was twice in Germany in May, actually.
so what kind of advice could you give to new people who want to go into the field of movement disorders or clinical physiology? Would you encourage them? Based on your life, it sounds like a good one, but is the field good in the future as it was in the past?
Yes, I think so. I think basically my original interest of the brain is still a fascinating and difficult subject. The brain is so much more complicated than any other organ in the body, and the idea of trying to figure out how it works, which is my main interest. How does the brain work? How does it do what it does? Is still extremely complicated and one of the major frontiers in science, I think. The whole notion of how this complex system is operating, and most difficultly, how it generates the content of consciousness is extremely, we don't have any idea. At some point, we'll begin to get some ideas, I hope, but in any event, there's an enormous amount to be done in that area, and I think that so the whole topic of the neuroscience of brain function is a fascinating one, and my sort of idea in general is that movement disorders is a very good clinical interaction with that particular interest. Movements are easy to measure. They're easier to measure than perhaps other types of brain function. And motor control patients, in a way, can be used as test systems. If you have a certain amount of damage to a part of the brain, then you help understand what that part of the brain is contributing to movement. And so, but it goes back and forth, clearly. If you know the physiology, then you can help the patients better. So it's a very productive interaction, and I tell the fellows that I'm training that you go both ways. You learn normal physiology and you learn brain pathophysiology, and they help each other. And in the meantime, as a spin-off, we may be able to learn something that will help the patients thereby. So I think it's still a field of which there's an enormous amount to be done and enormous fun to be had trying to deal with these very critical, interesting problems.
A field that I know you're very much interested in is psychogenic movement disorders, and which I want to come back to Freud, because you said you started out with Freud.
Oh, that's right.
And your thesis in high school. And so bring those subjects into the play. How'd you get interested in psychogenics, and tell us about the Freud story again.
Yes, right. So part of the fellowship program is training. And the training is now devoted to movement disorders. I mean, the fellows that come are movement disorder fellows. That's the main thing that they're doing. And as a part of the training, one of the things is to invite patients to come in that are difficult cases. We actually get referrals from the local area, but also around from the United States. And there was, at one point, I just recognized the fact that about 20% of the patients that we were seeing were psychogenic movement disorders. And I began to look around and say, well, what is the literature on that? What do we understand about it? And there was virtually nothing to be found. And the other interesting aspect of that is that while the patients look like they're making voluntary movements, they claim that they're involuntary. So it seemed to me that that was a very interesting model to begin to deal with the question of voluntariness. Voluntariness being an aspect of the content of consciousness I was just talking about before. So it seemed to me that if one wants a window into into the content of consciousness, that voluntariness is one way of getting to that. So that not only was it an important clinical problem, but it is really a fascinating physiological problem. So I decided, well, all right, this would be a worthy subject for study. And I must say that it was a little bit bold at the beginning because we didn't really know how to begin studying these patients. That there haven't really been very much study of these cases physiologically. And whenever I was asked what I was doing, and we get reviewed at the NIH in terms of what we're doing, I was almost afraid to say that I was dealing with psychogenic movement disorders. And we certainly continued our work in dystonia and other things because I didn't know whether we would be making any progress or learning anything. And we got no interest from the people in the National Institute of Mental Health. They didn't seem interested in this problem, although it seemed like an important problem for them too. So we just got into it more and more, both on the clinical side and the physiological side. On the physiological side, we began doing correlative experiments on just the sense of voluntariness. Again, thinking that if we learn something about that, we might be able to apply it to the patients with psychogenic movement disorders to try to figure out why they didn't have the sense of voluntariness with their movements. So that's also been quite interesting, getting involved with the physiology of free will, basically. And I've now been invited to a philosophy department to lecture on this particular topic. So it's gotten me off into a whole variety of interesting areas and interesting contacts. So we've been now spending more and more time with these patients from a physiological point of view, from a clinical point of view, from a pathophysiological point of view, trying to understand all this. And I think it's been fun, and we've been learning more. I think that our work has stimulated a lot of other people to get interested in the physiology of this as well, and that's been good. And as you know, I've now organized, together with your help and a number of others, 2 international congresses on psychogenic movement disorders, and both of which have produced a book in the end. And I think that that's also been useful in getting people to learn, both neurologists and psychiatrists, to become more interested in the field. So I'm now often a little bit braver in talking about the subject when I go to neurology rounds or medical meetings. And I think people are now beginning to get more interested in this subject. After all, it is extremely common.
Yeah, absolutely.
And I think that people have been pushing it off and have been missing a major aspect of neurology.
I think neurologists ought to get into this and help the patient. That's what we're here for, to help patients. So those who come with us with that problem, they need to be helped. But I want to get back to Freud, because you started out by saying you're interested in nervousness and came through reading about Freud.
Yes, and of course that's where we are with psychogenic movement disorders. Freud was a neurologist. He wrote some very good papers on neuropathology. He wrote a book on aphasia, and then he got interested in psychogenic movement disorders. Basically.
Well, psychogenic of any type, not just movement
well,
disorders.
many types of psychogenic things, but a lot of them were movement
Absolutely.
disorders, psychogenic paralysis and psychogenic movement disorders of various kinds. So, I mean, sometimes I feel I'm sort of following in his footsteps, having been interested, in my own career, basically starting in membrane biophysics and then working up through clinical EMG and EEG and then the physiology of movement disorders, and now I'm in the physiology of consciousness. I've sort of been working my way up. Pretty soon I'll be up here. I don't know.
And another pioneer in psychogenic disorders is Charcot and Paris, and with whom Freud came essentially as a fellow, postdoctoral fellow to work in, and he learned hysteria from Charcot, and he became interested in this. He realized we should study the psyche of the brain to find the cause of psychogenicity. So it's a full circle that you've
Yes.
done from high school back to now, and just like the hand.
No,
Many
no,
circles.
it's absolutely right. I sometimes think about that, but it is an interesting analogy.
Well, it was a great pleasure for me to interview you today, and we are friends and buddies in many ways, and so I had a great privilege to be the honored one to interview you.
Thanks again, Stan. It was
Okay.
terrific.